the discovery of medicinal cannabis. In the previous episode, we learned that in the late 19th century, domestic cultivation of cannabis sativa for medicinal use was believed to be comparable to cannabis indica. Advances in chemistry enabled the identification of cannabinol in cannabis, propelling its recognition as medicine. This marked the integration of medical cannabis into the portfolios of leading pharmaceutical companies. Episode 4. From Magistral Preparation to Pharmaceutical Manufacturing. In 1907, the Philadelphia College of Pharmacy in the USA approved a doctoral thesis titled The Comparative Physiological Effects of Several Varieties of Cannabis Sativa. The thesis tested 5 different varieties of cannabis sativa against cannabis indica, which was much more potent at the time. The student who wrote this thesis was Eli Lilly, the grandson of Colonel Eli Lilly, who later became the 3rd CEO of the Eli Lilly Company. During World War I, Lilly's cannabis business faced difficulties due to the closure of naval shipping lanes, which made importing the plant challenging. As a result, in 1912, the corporation purchased a farm in Greenfield, where they learned how to replicate the potent Indian type of cannabis. By using advanced methods of seed selection and cultivation, Lilly Farms managed to produce cannabis of high potency. According to Lilly's January 1927 catalogue, a complete price list of products, a bottle of cannabis sativa tincture was available for $6, which was 1/5 of the price of cannabis indica that was sold for $30 of the price of cannabis. Pharmaceutical companies offered cannabis in different forms, such as powder, tablets, fluid extracts, and tinctures. In the early 20th century, leading American companies were actively engaged in selling medical cannabis. Among them, Upjohn & Company had 30 products in its medical catalog. Parke Davis, now under Pfizer, offered 27. Eli Lilly had 23, and Abbott Laboratories had 4 products in 1935. European pharmaceutical companies were also involved in producing and distributing medical cannabis products, such as Merck in Germany and Burroughs and Wellcome in England. In Denmark, the cannabis-based medicine cannabisol was produced as a sedative at Lovens Chemical Factory, now known as Leo Pharma, and sold in Danish pharmacies until the 1950s. Cannabis also found application in veterinary medicine, with Parke Davis supplying cannabis extracts to veterinarians. These extracts served as pain relievers and sedatives for animals, addressing issues such as coughs and stomach ailments. The medical indications of cannabis were summarized in Seduce's Analytic Cyclopedia of Practical Medicine in 1924. 1. Sedative or hypnotic effects, addressing conditions like insomnia, melancholia, mania, and coughs. 2. Analgesic properties, alleviating headaches, neuralgia, and various pain conditions. 3. Other applications, improving appetite, managing digestive issues, and addressing sexual atony, among others. Cannabis was a popular medicine in the early 20th century used to treat various ailments. It is said to have been used by Queen Victoria against period pains. There is no actual proof of this, but Sir Robert Russell, for many years her personal physician, wrote extensively on cannabis, recommending the extract for use in dysmenorrhea. However, over time, shifting societal perceptions led to increased scrutiny of cannabis and its classification as a dangerous narcotic drug, commonly known as marijuana. Stay tuned for the next episode of the Western world's discovery of medicinal cannabis, as we delve deeper into the complexities of cannabis prohibition and its impact on scientific and medical practices.